All right, let's go ahead and get started. I just want to say thank you so much to everyone who's joining us here tonight for such an important topic and discussion on youth mental health and wellness. So we'll start with Dr. Jacobs, Dr. Sheldon Jacobs, who will be opening with our welcome remarks.
Thank you, Tran. So first off, I'd like to thank all of our panelists for being a part of this tremendous event. I also want to thank NAMI Southern Nevada, as well as AmeriCorps and Hope Means Nevada. And so before I go further, I want to also take some time to just recognize the families, the many families out there who've lost someone to suicide. Our hearts definitely go out to all of those who who've taken their lives, so quickly through the suicide. And so we also want to make sure that we, let all the families know that, we won't be forgotten. The next part I wanted to sort of elaborate on a little bit is the statistics as it pertains to suicide and mental health. So one of the things I want to share with all of you is, so one stat, and this stat really jumped out at me, and the stat is, it pertains to, the number of so let me go back. So 1 out of 5 adolescents have either thought of taking their lives, have either attempted, or have persistent thoughts of suicide. So let me rephrase that. 1 in 5 adolescents. Okay, and this is not just Nevada, but this is everywhere. Okay, so 1 in 5, that's a pretty significant number. The second statistic I want to share with you as well is, and this comes from the National Institute of Mental Health, and that is suicide rates tend to double after a crisis. And so obviously right now we're going through a pandemic, and many experts out there, feel that, the suicide numbers will spike even more as we navigate through this pandemic. And even long after the pandemic, there will still be a lot of residual effects as well. And the last statistic I want to share with you all is that the suicide rates amongst Latino and African-American youth have also increased, especially amongst African-American youth. They've close to tripled in the past couple of years. So this is even pre-pandemic. And again, understanding the fact that, crisis like a pandemic will only increase those numbers, unfortunately. But one of the important things, and that's why we're here today, is to spread awareness. To let everybody know that it's okay to not be okay, but it's not okay to not seek help. So there's plenty of resources here to help all of those that are in need. So without further ado, also we have a special guest, Trustee Linda Cavazos, who has dedicated so much time, not only to just being on the school board and all the work she's doing in the community, but also Trustee Cavazos is a licensed marriage and family therapist. Thank you, Trustee.
Thank you, Dr. Jacobs, for the introduction, and thank you for this invitation to be on this very important panel. This is a conversation that we need to have. This is a situation right now that, again, this is a phrase that's been used many times during the last 6 months, but there is no better, and that is that this is an unprecedented situation, living situation that we're all going through right now. So I'm going to build on something that you just mentioned a moment ago, Dr. Jacobs, and that was awareness. This is a panel tonight with different areas of questions that we're going to be going over. But overall, we want to talk about bringing awareness to all different entities around us that deal with our youth. So we're talking about our parents, we're talking about the students ourselves. We have a student on our panel tonight that I'm very happy about, our community, our educators, and something that I want everyone to keep in mind as we go through the discussion tonight with the questions and answers that we have ready for you and that are also going to be coming in, is I want everyone to remember a couple of different phrases, and they're very simple. And one of them is making the connection. It's reaching out and making the connection. And the second one's not even a phrase. It's just one word, and it's listen. Because too many times we, the so-called adults in the room, we're so worried about our own biases or how we're going to say something or what the reaction is going to be, that we forget that sometimes we're not there to fix things. We're there to listen and to take our cues from the young person that we're talking to, or whether we're talking to a parent that's very distraught, an educator who has a student that they're very worried about. So this is something that when we open up this conversation, when we start having this dialogue, we want to find a way to keep that dialogue going, to keep it sustainable, and to keep it open so that the young people, no matter what age they're at, that they feel comfortable being able to come to somebody that they trust to talk to. So again, I'll go over that again. It's making the connection and listening. Thank you. Thank you again.
And thank you so much, Trustee Cavazos. So again, my name is Trin Dang, Executive Director of NAMI Southern Nevada. I just want to let you know a little bit more about NAMI and what we do and what we offer, because with mental health conditions, with suicide on the rise, whether we talk about it or not, it's happening. So I'm so excited and so glad that we have a panel of experts here today to be able to share some insights and tips and really start that dialogue, because it's so important that we open up the dialogue. And as we talk to each other, it's a healing process. So that's what NAMI is here to do. Our organization's mission is to improve the quality of life through advocacy, education, and support. And we do that by increasing awareness through events like we're doing today, as well as reducing stigma surrounding mental illness. Because it's okay to not be okay, and it's okay to talk about it. And the more that we talk about it, the more that we find that others might be experiencing similar situations, experiencing similar emotions and feelings, and that we're not alone. So thank you so much for joining us here today. Just a few quick things about housekeeping. If you are with us on Zoom, the Zoom webinar, thank you for joining us. If you'd like to ask a question, please feel free to type into the Q&A box. That'll let us know that a question has popped up so that I can go ahead and either share it with our panelists, or someone may be able to type into the Q&A box. If you are joining us on Facebook Live and you'd like to be able to ask a question, please click on the link and join us in our Zoom webinar, where you'll be able to type into the Q&A box for questions. There is also a chat box where as people type into the chat box, the panelists will be able to see. But if you are asking a specific question, please make sure that you type into the Q&A. And just as a note, we might not get to all the questions, so we do apologize if we don't get to them, but we'll try our best to get to as many as possible as we go through our program today. So I'd like to go ahead and introduce our panelists here today. You heard a little bit from Dr. Sheldon Jacobs, who is a licensed marriage and family therapist. He's worked primarily with children and adolescents in various clinical settings for the last 19 years. He currently works in public and private sectors, providing clinical administrative oversight for children within the child welfare and juvenile justice system, along with providing individual and family therapy for children, adolescents, and adults in the private sector. So Dr. Jacobs was appointed by Governor Steve Sisolak to the State of Nevada Board for MFTs and CPCs in October 2019, and he's currently serving as the Vice President on the Board of Directors for NAMI Southern Nevada chapter. We're so excited to have him here today. We have next Emily Andaya, who's the owner of Sweet Relief. She's a senior dance major at Las Vegas Academy of the Arts. She's also a mental health advocate and owner of Sweet Relief, which is a small business shining light on the importance of managing your anxiety by providing coping tools for all ages. We have Belinda Marchoud, who's a licensed marriage and family therapist. She was raised in Las Vegas and comes from a Mexican background. Belinda has practiced community health for 7 years. She's also specialized in childhood trauma and currently has her own private practice and also works with mental health agencies in the community. Next, we have Jennifer Vobis, who's a marriage and family therapist as well, marriage and family therapist intern. And as a former teacher, she's dedicated much of her professional career working with children and their families, including individuals with disabilities. Jennifer enjoys working with adolescents, helping them to improve communication, confidence, and their relationship with others. And last but not least, we have Trustee Linda Cavazos, who was appointed to the Clark County School District Board of Trustees on August 17th, 2017. Then was elected in November of 2018 for a full year term. Trustee Cavazos represents District G. She's also taught at Basic High School for 15 years. She was then an adjunct professor or instructor at UNLV for 9 years while beginning a private counseling practice. Trustee Cavazos currently works as a family therapist part-time, working with young children and adolescents, suicide and gun violence survivors, and veterans suffering from PTSD. So as you can see here today, we have a panelist of experts with varying experiences, with a whole lot of experience working with youth and adolescents. So we're so excited to hear from them today. We'll go ahead and jump right into our questions. And for the panelists, as I ask the questions, please feel free to also answer if you feel inclined and would like to add any information or insights to each of the questions as well. But this first question here is for Dr. Sheldon Jacobs. Why is it important for parents to take the time to listen to their children? Because earlier we heard Trustee Cavazos, mention the word listen. What are your thoughts on it?
Yeah, good question. And I'll say, with children, it can be somewhat of a challenge because a lot of times children aren't, they don't typically articulate what's going on with them or what they're feeling. A lot of times they demonstrate what they're feeling or experiencing through their actions or their behaviors. And so a lot of times I think for parents, it's important that you're in tune to any behavioral changes that you may see in your children. As well as for parents, and I get this a lot of times with some of the families that I work with, where they may have children that are a little bit maybe feel a little unsafe, sort of sharing certain things with their parents for different reasons. It could be maybe based upon the reaction that mom or dad may give, or it could be that maybe mom and dad are so busy with their day-to-day lives, and everything is just so fast that when their kids try to tell them something that the parents aren't completely engaged or present as well, so they don't share things with them, right? And so I think it's very, very important that as parents that we try to slow things down as much as possible. And I know a lot of times that's difficult, especially in the times that we're living in with the pandemic and just the different stressors that come with that. A lot of our kids are doing distance learning, so that's another added stressor. So I think there's a multitude of factors that sort of prevent parents from being really in tune to their kids. But I feel that also a lot of it is, a societal thing. I feel that we have gotten in a hurry over time. And I think that one of the things that the pandemic has shown us is that, it's important to slow down. And I think it has forced us to slow down in many respects, right? And so I encourage parents to take time, whether it be over the dinner table. I think dinner time is a very important time to check in with our children and to kind of see what's going on, see how their day is going, just have just normal dialogue, right? And I think that as a society, we've sort of gotten away from the dinner table. We've gotten away from sitting down as a family and having meals. And so one of the things I encourage, all those parents that are listening in, please try to find that time, whether it be at dinner time, whether it be at night, if you have younger kids and they're still in that age where they get tucked in, have to sit down and have conversations with them as you're tucking them in. I know that's also vitally important, where you kind of go over the day, how things went throughout the course of the day. But I think as parents, we have to stay in tune as much as possible. Thank you.
Thank you for sharing that, Dr. Jacobs. Yes, it's definitely a time for us to slow down because we're inside our homes and there's not much to do but to really slow down, and hopefully we can take that time for some self-reflection, time to spend time with family and to really listen, as we've talked about. So this one kind of follows up with that, where not only are we just listening, but why do you think mental health should be a communicated topic to our youth today? And this question is to Emily. So not only are we listening, but communicating about mental health.
Hi, so I believe that mental health should be a communicated topic to our youth so they can begin to become educated about the importance of it. I believe that once you start educating children, the youth, like I said, about the importance of recognizing your mental state, how you're feeling emotionally, and how you're doing mentally in general, it'll set them up to be able to manage and regulate the mental challenges that they face later in life. That's for one. For two, I believe, like Trustee had mentioned earlier, that it should be an open discussion that we talk about, especially because I'm a kid. I mean, I think that I've had the opportunity to have a lot of open discussion, and I'm very grateful for that opportunity. But part of that includes erasing the stigma, the negative stigma that we put around children opening up about their experiences with mental issues regarding mental health. I think that once we erase that stigma, then it'll become an even more open discussion, or past the youth, it can be include all age groups, for the youth to be able to understand why their voices are valued and they should be understood.
Thank you so much, Emily. And I heard you mention the word stigma. I remember a long time ago, the first time I heard that word, I didn't really understand what that meant or know what it was. But when we talk about stigma in mental health, it's basically having negative attitudes and belief against people who have mental health conditions or just mental health challenges themselves. When in fact, we all have mental health, just like how we have physical health, dental health, vision health, we all have mental health, and it's about our emotions and our feelings, which being human, we all have. We all have emotions and feelings, but unfortunately as adults, sometimes we might not know how to identify them either. And so it's difficult to communicate that to our children. But there are ways that we can learn how to do that for ourselves and also be able to do that for our kids. Just wanted to quote Mental Health America as I was reading a report earlier this week. Some of the key findings that they just released in a report released this year was that young people are struggling the most with their mental health currently, and it's actually worsening. So, as I've said earlier, whether we're talking about it or not, it's happening. So why not open up the dialogue and really start it just by sometimes communicating how we feel about certain things. We can start there. So my next question is, how can we communicate with teens using social media platforms? Because we know that our youth are really on the social media platforms. I know TikTok has become a big thing nowadays. That question is for Belinda.
Hi, thank you. I think it's really important to talk about this because during this pandemic, we see that distance learning kids are probably more engaging in their social media and kind of using it as a way to connect with their friends and family and using it for entertainment. So if we look at, just how many kids use social media, it is most of them do every single day. And then we look at social media as a really big influence for our youth, and so it's important to really understand that it's a whole other world for teens. And as a therapist, I think social media has been so vital to really getting into their world and understanding them and building rapport with them. And so I think it's really important to educate parents, counselors, teachers on how they can do that as well to build this rapport and kind of get in a different perspective of their world. And when we talk about listening, this is another way that we can listen to our youth. And so some of the questions that we can ask them is, how are they involved in the content that they look at? How are they using their social media to connect with their peers? How does what they look at kind of relate to their own life? And using social media as a learning opportunity, connecting with different communities, exposing themselves to new ideas. And, I know one intervention that I like to do is really looking at how they can find videos for inspiration and kind of using social media to learn more about themselves and be more in tune with how they're using it, right? And kind of having goals into how they're using it. And does that and how they're using it kind of go together with what they're doing on social media, right? So social media can really give us a good window into how our kids are relating to their peers and the world around them. So I think it's really important to help them see social media as a useful tool and something that can help them to express themselves in a healthy way, but guiding them through that as well. And just because we don't understand it, a lot of parents don't take the time to really invest in kind of what their children are looking at in social media. And I think, that shouldn't really be an excuse because we don't understand it. And it's a way for us to connect and kind of build a closer relationship with children and teens. So I definitely think there's a lot of opportunities of using TikTok, of using, the different apps and kind of learning of why they're using them and growing together and doing things together and, maybe watching videos together, scrolling with them, and just a way for them to connect.
And thank you so much.
Can I
Yeah.
jump in? One of the things I think that Belinda brings up some really good points, and social media is kind of the double-edged sword. It's a good way for teens to access information if they are having suicidal ideations. They can get they can look on their social media for phone numbers and support. There are support groups, private and public Facebook support groups for teens who are experiencing anxiety, depression, anger, and those kinds of things. But again, I think Belinda has a really good point in that it should be monitored, and what teens are accessing is important for parents to know. Thanks.
And I'd like to jump in on the social media because we had a Q&A. I started to type. I typed a couple of answers, but there's a couple more that come in, but also on the social media too. Having kids of my own that are grown, but even looking at some of their younger friends, their parents are very hesitant to say to them to just like walk away. And, Belinda brought up a very good point as far as, scrolling through with them, looking at what they're looking at. Sometimes you might get a surprise or two that you don't want to look at, but they are seeing that you really care and that you're interested. But something that I'm saying to parents, teachers, and kids, and this has to do with the Q&A question about a 17-year-old that is getting very angry sometimes, on social media, and especially about politics, is sometimes it's just maybe plan an activity. Everybody says, go for a walk. Okay, sometimes your kids don't want to go for a walk. Maybe if you have a dog, you can take the dog for a walk, or maybe you can just go out and grab a snack someplace where it's safe. That's very popular with me, by the way, the grabbing a snack. But you need to find something to get them away from that screen, because right now, during distance learning, they're in front of that screen too many hours. I'm just going to go out ahead and say that, too many hours. So if you see their behavior changing, they're starting to get rude towards you, they're angry, it's a danger sign. It's a red flag. It's showing you that it's affecting them in ways that you don't want them to go in that direction. So I'll just end with that. And I believe there was another question there, but I'm going to let Trin get back to hers, and maybe we can cycle back to that. But thank you, Belinda. Those are all really good suggestions.
Yes, thank you to all three of you. Yeah, there is, benefits to having social media. There are pros and cons to it. And as everyone stated, just being aware and then monitoring, but knowing that it can help in helping them stay connected in a world where we have to kind of social distance, but knowing what it is that they're looking at, because I know oftentimes for myself, even I've had to stay away from all the news and everything that's going on. So we do have youth on here today with us, just to make sure that you limit what you're looking at, because that can affect your mood and how you feel. And it's okay to, kind of put that away and just really spend the time with the family or the people that are there with you. So yes, I do want to circle back to some questions, although they've been answered. They were great questions. With so many students learning from home, is this lack of socialization and normalcy impacting their mental health? And Trustee Cavazos, and I see everyone's head shaking, yes, but yes, it is in fact affecting them. So as we mentioned earlier, finding that time to really sit down and ask them questions and listen. Although their world and what bothers them and what they're feeling might be different from what our perspective is as an adult, it's so important to provide that safe space just to have them express themselves. And some things that might not seem as big of a deal to us, that's the world to them at this point at their developmental stage. So we want to make sure that we provide that safe space just to let them know, hey, I get it. Like, yeah, it's tough. When I was your age, I didn't have this happening in the world today. Um, and then another question was, what do we recommend parents do for students struggling, which we'll actually get into in our next set of questions. And we have a few more questions as well. So our next one is, let's see, what can we do to get more volunteers into the schools, the middle and high schools that are overcrowded, and the social workers and counselors so that they have more, so that they have to touch, I'm sorry, just kind of reading through this. So we need more people that can listen and help students, basically is what we're saying in the schools. So I don't know if there's someone that's able to answer that question or to try to tackle that one. I know that's a tough one with the mental health state in our services in the state of Nevada.
I see Dr. Jacobs going, okay, Linda, go for it. Okay, so right now, of course, we're in a very unusual situation. It's not something like, before, where we could just have parents and grandparents and family members and friends come in and sign up, be fingerprinted, background check, and be able to come in, because now we have the safety precaution and the kids are at home. So what we're trying to do right now in the district is we're looking at mentoring programs, and we're looking at suicide prevention programs and peer counseling. And I'm going to tell you right now, I won't even pretend on this, I am a huge advocate. If there's a kid that wants to talk to me at school, and there's a kid that wants to talk to Emily at school, guess who they're going to go talk to first? They're going to go talk to Emily. We have a pilot program that we had just begun and gotten it started over at Miller Middle School. And some of you may be familiar with it. It's called the Hope Project. And it is something where the children, the peers are trained. The teachers are trained first, they train the kids, and then the students are made aware of who the peer counselors are. And they're always supervised. They're not taking the place of therapists. So, and parents do have to give permission. But I think that if we can get more programs like that going, it's going to be a big, huge step in the right direction. Because sometimes the adults will come in and they mean well, but maybe they don't know really the culture or the climate of the school that they're in. And a school maybe up in Summerlin is not going to be the same as a school over in my East Las Vegas district. And I don't mean that in a bad way. I just mean it's different. It's different. So I think Emily would agree that the culture at the different schools is not going to be the same. So we are working as we get ready to go into the next phases with school instruction of figuring out how we can do that and take some of the load off the plates of the teachers, the social workers, the psychologists, the school success advocates, all of them. They have way too much on their plates. And then the parents at the same time are struggling and needing help. So it's a huge undertaking, but I know that if we all work together, we can do it. We can do it. But it's kind of in a different ballpark right now because of the pandemic.
Exactly. Thank you so much for sharing that. And just to kind of end with that question, because we were talking about social media. One of the beauty of social media is, as we said, is getting the word out there. I know with Hope Means Nevada, they've done a lot of awareness campaigns with their social media of, just starting the dialogue. We hear them on the radio, see them on billboards, making it okay to reach out to others to see if they're okay. I know they have an Ask 5 campaign. So one of the things that you can do is reach out to your friends for the youth, or, be able to go on social media to say, hey, how have you been? Whether you're connecting through phone or text or through chat on Facebook Messenger or Instagram chat or TikTok, whatever it is. But I hear sometimes parents do get hooked on TikTok as well. I see a lot of parent and child dances together. So maybe it's worth taking a look at for our parents out there. So we'll go ahead and go on to our next question. What are some signs to look for when a child is struggling mentally? And when is a good time to seek professional help? Dr. Jacobs?
Sorry, trying to unmute myself. So yeah, so that's a somewhat of a loaded question because, and I'm gonna give you sort of two parts to it. So the first part is obviously if you notice that your child is their functioning has changed a little bit, whereas maybe they're having difficulty sleeping, if their appetite has been impacted, if they're having a hard time getting up in the morning going to school, if they are more irritable, if there's any other subtle changes to behavior, could be just verbal aggression or anything out of the ordinary, that may be a sign that something underlying is going on. However, the other piece to that is, and I tell parents this a lot, and that is, sometimes I think, as a culture, we are very reactive. We tend to wait until the very end, like for instance, we might wait until a kid, our child has been expelled from school once or twice before we get them the necessary support and help that they need. And so we don't want to do that. We want to, sort of be proactive, and we want to focus on, any signs early on. And I'll give you an example of that. So, for instance, if you have a kiddo who's, let's say, their parents are going through a divorce, okay, and there's been some signs that the kiddo's in distress and is having some difficulty. Why not try to look for some extra support and professional help now versus waiting till perhaps after the divorce is finalized and that child has been in more distress and has endured more symptoms, right? And so something sort of kind of rewinding and looking at, okay, these are some of the things that I see going on. Let's see what we can do, and sometimes before even reaching out for help, obviously parents know their kids better than anybody. So a lot of times it could be a matter of sitting down with your child and and find out what's going on. How can I help support you? How can we get through this together? So sometimes it's just a matter of having that conversation and kind of as a parent, maybe doing your own assessment. Sometimes that may go further than a complete stranger, like a professional, like ourselves. Sitting down and trying to do counseling or trying to do an assessment on them. Sometimes it starts at home with the parent because parents know best. So I would suggest, for all parents, if there's any signs that your child is having some difficulties, talk to them, see what's going on, see if it's something that can be rectified. For instance, if your child is, maybe having a lot of stress over school, because maybe they're feeling overwhelmed. And so obviously stress is normal. There's some positives to stress, because stress can help motivate us, right? But however, when that stress becomes more internalized, then sometimes that becomes more of a problem, right? So if a child starts internalizing, these sort of external things, like school and grades and what's happening at home, and so they're waking up each day and maybe there might not be an actual threat right then and there, but they're still feeling very anxious. Then that might be a sign that that child might need something additional or more support. So yes, for parents, just be in tune, as much as possible. Have these conversations with your kids, and again, go back to the point that I made earlier. Sitting down with your children. If it's around dinner is a perfect time to have conversations because everybody likes to eat, right? And so. And it's usually dinner times around is usually the time where everybody in the household typically is sort of doing the same thing, right? Typically. So I encourage all parents to be in tune with your kids.
Thank you, Dr. Jacobs. So we have a question here. Since lockdown, schools have been closed and many children are forced to do distant learning. And reports have shown that COVID lockdowns have masked the increased rates of child abuse and neglect. So how do we see the signs of abuse or if a student is struggling mentally when classes are now online?
That's a tough one. And obviously I'll let some of the other panelists, speak on that. But, that is a very difficult one because obviously, it's kind of, you probably heard this, it really is the epidemic within the pandemic, right? So we obviously we're in a pandemic right now, but there's also an epidemic of, abuse that's going on, domestic abuse, child abuse. And one of the reasons that is spiked is because school, for one, kids aren't in school, or at least large numbers of children aren't in school, and so school a lot of times can be somewhat that buffer or that extra support system, right? And where there's an extra set of eyes, on our kids. A lot of times our teachers, our great teachers and administrators, a lot of times they've been trained to look for, various signs in our children to see if something is amiss or something's going on. And so, since school, is, not a option right now for many of our children, it has, added more challenges, right? And so I guess I guess it's not an easy answer, to that question, but one of the things I will say is, for those in the community, if you see a kid maybe out in the park and maybe sees something going on, the parents are being abusive or being appropriate with that child, or if you notice something that leads you to believe that something is not right. So always trusting that our gut feeling. You've probably heard the term your gut feeling, or our own intuition. Always say trust our intuition. So if you see or sense something that's going on, call the authorities, call 311 if you have to. But again, it's hard. It's hard right now because a lot of kids are isolated. They're at home, and a lot of things are still closed. So there's not too many outlets, not too many places where families can go. And so a lot of times, unfortunately, that stress gets built up, in the home, and unfortunately, bad things tend to happen, when you sort of mix those two or three things together.
Thank you so much, Dr. Jacobs. And I heard earlier that you mentioned 311. For any parents on there that aren't familiar with what 311 is, it's a non-emergency phone number that you could call authorities, law enforcement out. So if, for example, if you do witness some type of domestic violence or childhood abuse, or even suspect that a child is in danger of possible suicide attempts because of something you've seen on social media and you know where this person is, you can actually make the call to 311, give them the details and information for them to do a wellness check. And all it is an officer coming to the scene to say, hey, is this person okay? Because, oftentimes it's better to be safe than sorry. And I have had to make that call before. And luckily I had an amazing officer from Metro that called back hours later to tell me, hey, I visited this person for this, this call that you made, and this person is doing okay, they're fine. And that kind of put my heart at ease because I was afraid that something was going to happen to them. So I just want to let everyone know that that number and that resource that's there.
Shin, can I jump in there for just a sec?
Yeah, of course.
I wanted to say here, and Dr. Jacobs, you're absolutely correct. It's just such a huge obstacle right now without the kids being able to be in the rooms with their teachers, with the support professionals, etc. So right now the district is doing wellness checks. We have whole teams of community members. I know that the Hispanic Caucus, and I don't know, Belinda, if you were connected with any of them. I wasn't able to go out on any of those because I've been having to go in on weekends to work. But we had community members, we had social workers, we did have CCSD or Metro if it's an emergency, just like Trent said. But our teachers and our support professionals online have been some of our biggest helpers because they're able to notice if a child all of a sudden seems kind of quiet, and they're usually kind of bubbly and very outgoing, or if they all of a sudden start turning off their camera and they were somebody before that was entertaining you, on the screen, but you're looking for differences in behavior. If they seem kind of quiet, we're basically looking for differences. So I will tell you that our teachers and our support professionals have found some issues so far. There have been some reports. I'm not at liberty to go into numbers or anything like that, but they've been some of our biggest advocates. And we sometimes try, even though Metro and our CCSD police are wonderful, it's sometimes a little bit, if a child is already feeling a little bit withdrawn and they don't feel like talking to somebody, they can get a little bit nervous if they see a uniform, unless it happens to be, maybe it's a school officer that they know. And if they do know that person, they're going to be a little bit more comfortable, but they might be a little bit more opening up if, say, a social worker or a teacher who's familiar to them, hall monitors. We've even had some of our food service workers and other community members that have volunteered and it's worked out really well. So it's just really difficult right now, as Dr. Jacobs said. It's just really hard. I would say that the most important thing is to be observant. We all have to be so observant, whether it's like as Trent said, or Dr. Jacobs, if you're at the park or if you see a child that you know in the neighborhood or there's something going on, but we have to be so observant of what's going on with our children. And it's so hard right now because those warm little bodies that we wish were in our classrooms right now are not there. They're on a screen in front of us. So we have to work that much harder.
Very great point, Trustee. And can I add, just we are in such a unique sort of time right now, a very unique time. And one of the things I heard you say, Trustee, is the importance of sort of being aware of your surroundings, what's going on around you. And also, I think, for us as a community, I think it's so important that we come together as much as possible, and to see how we can support one another, regardless of whatever entity or line of work we're in. But it's so important that we come together, because I feel like, this pandemic has created so much stress and frustration. And on top of that, there's other things going on, elections, and, there's just so much, divisiveness that's going on in our time right now, which I think is also adding to the stress and, a lot of the, social issues that we are seeing today. And so again, I think it comes down to, all of us doing our part, working together as best as we can.
I'd like to add a comment to that. I do think that a lot of our community has made our children and our adolescents a priority. I know the city of Las Vegas is sending out the troops to check on children as well in their wards, and the efforts that Clark County School District is doing as well. We are really trying to we recognize with the pandemic we recognize the community with the pandemic, the stress that it's causing. And there are a lot of us rallying together in order to make sure that our kids are safe.
Yes, and thank you so much for sharing all that. So there was a question for Trustee Cavazos. Are these peer programs available in private schools? Or will they become available in private schools eventually?
Trin, I don't know that at this point. I do know of one school through one of my private clients that they do have, they have outside facilitators that come in and train the teachers, but I'm not sure if that's not going on still. And it is a private parochial school. The project that I was talking about with the peer supports before, and I'm glad Jennifer reminded me of that as far as our community partners, all of our middle schools and our high schools that are within the city of Henderson received that program, and it was fully funded by the city of Henderson. So we're looking for more partnerships like that. We have a lot of business partners. We have a lot of philanthropists that are willing to help. But one of the things that I keep hearing is, they're coming to us and saying, oh my God, we didn't know that we had such a problem. And so, I think all of you here would agree with me, this pandemic has shown a bright, focused, extremely laser-like focus on the inequities. And one of them is on mental health services and paying attention. So these issues were here before the pandemic started, but now with the social isolation and with kids not seeing their friends or their teachers, it's under a microscope now. And so that's where we're at. I don't know about the private schools. I'd be interested in talking to some of our private and charter schools, because as Dr. Jacobs said, if we don't work collaboratively, we're all going to be going off in different directions, and we have these common goals to help our kids. But if we're focusing on our differences instead of our commonalities, our kids are the ones who pay the price. So.
Exactly. So every private school seems to operate differently. So it might be best to check in with the school and ask them is what it sounds like. So our next question kind of follows up with the last question we had, which was looking for signs of a child struggling mentally. But what if it goes even further? And, what are the warning signs or risk factors to look for with children or teen who may be contemplating suicide.
Is that my question, Trin?
And that is for Trustee Linda Cavazos.
If since I've been, I think, talking too much, if you'd like to go to one of the other panelists and then come back to me, that would be fine, because I don't want to monopolize the conversation here, but I'll be glad to come back and answer both of those questions.
Sure, definitely. So we have another question, because we know that so many families are affected right now, not just our children, our parents, with the economic impact of job loss and just things happening. So how can families help each other cope during this pandemic, Jennifer?
An idea that I've stolen from Brene Brown that I love, and that when I'm working with families, I tend to use, and what it is, it's to develop a family plan. And what a family plan is it's a plan that the family creates together to make sure that all the needs are being met. It's also to develop strategies to deal with stress and make sure your family's staying connected. So in a family plan, some of the things that it can include is having a daily routine. Daily routines are really important because it allows family members to have predictability and stability. So what does our daily routine look like? And especially important during distance learning, because there has to be breaks and dinners and breakfast and all kinds of things. So making sure everybody has what the daily routine for the family looks like. Also, how do we spend time as a family together? Do we have family game night? Do we have family movie night? Do we go to the park? Do we exercise together by taking bike rides or walks? Do we have dedicated time? And I think Dr. Jacobs had mentioned this a couple times. Do we have dedicated time where we can have conversations about topics that promote communication? One of the things that I give my families communication starters, and they're things as simple as, if I could take 3 things to an island, what would they be? And it's really just trying to listen and open up communication and teaching families how to talk. I know it's important that families stay together or spend time together, but when you're in quarantine, too much time could be too much time. So in a family plan, not only how do we spend time together, but how do we take a break from each other? And what does that look like? Is everyone allowed time to have time to themselves, to do the things that they enjoy? Is there places where when things get overwhelming with the family, or they just need a break from something, do they have a safe place in the home where they can just go and relax? And last, I think what's important in the family plan is, how do we support each other when we're struggling? What does that look like? How do we check in with each other to see what's going on with us, what we're struggling with today? And at that point too, when is it okay to reach outside of the family to ask for assistance and help? So those are some ways that families can stay connected and also support each other.
Thank you so much, Jennifer. So I wanted to go back to a question that was asked earlier, which was for high schoolers when they ask about the future. Is it okay to admit that we do not know, but to share your family's?
I think Trin is frozen there.
I think so, but I'll step in real quick, because I want to kind of piggyback off of Jennifer really quickly, and that is, I think one of the things that we must understand too is that connection and belongingness is a basic human need. We have that Maslow diagram of basic needs like food, water, and shelter, and so connection is also a basic human need. And so a lot of times, when that's somewhat, I'm gonna say taken away, but when that's sort of when there's challenges that come in between that connection or being able to connect like we want to, especially some of the challenges that have been brought on by the pandemic, for instance, it's important that we still find a way to connect, as best as possible, because again, one of the things that, I think a lot of us are seeing is, children, adolescents, adults even are isolating themselves because, there's this emphasis on social distancing. And, and I get social distancing, obviously is important, but sometimes the verbiage there, the vernacular, kind of can get misinterpreted, because when I hear the word social distancing, I'm hearing, don't socialize, keep a distance from other people socially versus physical distance. I like to use the term physical distance versus social distance because some people interpret that, many different ways, right? And sometimes it's not always in a healthy manner. Obviously, we get what social distancing means. We understand that, especially by now, 7 months into the pandemic. But I think it's important that we practice social connectedness as much as possible and physical distance as much as possible. So I just wanted to throw that in there.
Is Trin back with us?
Yeah, she's back. Are you back, Trin? There she is.
There she is.
I am back. So sorry about that. That was the strangest thing ever. My computer decided that it was tired and it just shut off and restarted all of a sudden. I'm not sure what quite happened. So I apologize for that, but I am back. So let me get the question right back up. And I was referring to one of the Q&A that someone asked about, just being honest with their kids. So if we're unsure of something, if we're feeling a certain way, it's okay because it shows our vulnerability. And that kind of goes into earlier what Jennifer said about Brene Brown. I absolutely adore her and love her because she talks about vulnerability. And vulnerability is what helps us build connections, is what she has found. The more we open up and share with each other, the more connected we'll feel in this world where we might feel disconnected because of, social distancing and isolation and all that. I don't know if we had continued on to the next question yet, Dr. Jacobs? Okay.
I think you were about to ask a question, Trin, from the chat, or I think you're about to ask a question. So I went ahead and added something to what Jennifer had said, because we had lost you for a second. So.
Can I add one more thing, Trin, too? I think that it is absolutely okay for parents to discuss how they're feeling with their children, that they are vulnerable, but it also shows their children and models for their children that, it's stressful for me and this is how I manage my stress, or I really messed up today and I make mistakes, and that's okay because sometimes we do make mistakes, and that's how we overcome things, by learning from that. And it models good, resilient behavior for children and for their adolescents. But it's absolutely okay to talk to your teens about how you're feeling.
Thank you so much. That's so important because once, when they become adults, they'll remember back to how their parents had reacted and what they did and what they said. And that kind of really lays the foundation for, how they can cope and talk about things, or, be able to share as they get older. And I do apologize because I got logged out. The questions that were on here prior kind of got deleted for me. So if there is any questions that any of the panelists would like to address, please feel free to unmute and then read any of those questions off, or to answer those questions as well. So I'd like to go back to Trustee Cavazos with the question on how can a parent talk to their teen, or I'm sorry, yes, how can a parent talk to their teen about suicide? If, what are the risk factors? Well, first of all, what are the risk factors or warning signs to look for with children, for child or teen suicide?
Thank you, Trin. And I will probably just kind of meld both of those parts of the question together, having to do with the warning signs and also how to talk to a child. I'm going to just go ahead and start out with kind of a little anonymous vignette from many years ago. I had a student come in for a session, had been referred by their school counselor for suicidal ideation that they had confided in their school counselor. When we got to the part about is there anybody in your life, whether it is a relative, a parent, a friend, the young man who was 15, and again, this was many years ago, said, I would like to talk to my dad. I think he would understand, but I can't. And when I asked him, what is the roadblock? He said, because his best friend took his own life when he was in college, and I don't want to make my dad cry. And so he was aware of the background. He felt that his dad would be the one that could best understand him. But he wasn't, I don't think he was prepared at that time to see how vulnerable his father might be. And so I think sometimes we have to realize how much our children know about us and how they don't want to upset us. And so they may not want to talk about certain things. I've had parents say, you know, we can't get, and I think it was in our summary, Dr. Jacobs, where, you know, it's sometimes hard for parents to get their kid to even tell them what was your day like, much less, you know, to talk about something like this. So I'm going to backtrack a little bit. Parents know their children better than anyone, but sometimes that's not who they're going to talk to. But if you see your child changing, again, as I mentioned before, if they're different, if they're usually outgoing and all of a sudden they're withdrawn, Dr. Jacobs had mentioned making family connections, and so had Jennifer. You know, if they usually like to eat dinner with the family, all of a sudden they're staying in the room and they seem to have a case of the blues, except the case of the blues doesn't go away. It lingers. It's turning into depression. They're having trouble even trying to do normal things like, you know, getting dressed or brushing their teeth or whatever. Then that's something to look out for. The other thing that you really want to look for is a feeling of hopelessness. Does your child or your teen all of a sudden seem like they're not enjoying like normal things? They don't want to talk to their friends even, or they're not texting. They're not doing anything. They just don't, they seem to be disconnected. Are they asking questions about wanting to give away their things? That was one thing that one mom came into me with. And she says, I don't know if this means anything, but my daughter is trying to give away some of her most treasured possessions. I made an appointment for that young lady that same day. So you're looking for differences in what they're like. If they start to seem like, you know, like all of a sudden the burden of the world is on their shoulders, or conversely, do they seem like they're feeling like they're a burden to you? And normally they would come and talk, maybe a daughter comes and talks to her mom about a lot of different things, and all of a sudden it's, oh, I don't want to bother you. No, it's okay, everything's fine. And you can obviously tell that things are not fine. So those are just, that's a very quick summary synopsis. Suicide, especially youth suicide, with our numbers right now, we're the largest age group that we're seeing the biggest uptick, is horrifying. The first time I read it, I thought I was looking at the data wrong, and it's ages 10 to 14. So when we are looking at that, it should send a deep shudder through every parent, educator, adult, everybody, because that is not normal. But when I say the word normal, look at how we're living right now. And these children are disconnected from all of the things that anchored them in their life, their friends, their teachers, even just the social interaction. So what we want to look at right now as far as talking to your child is something that some of you have already brought up, and that's being open, honest, as Jennifer brought up, letting them see. If you end up starting to cry because you remember a friend that you lost, or you know, you have just recently learned of the suicide of somebody at your school or in the valley, if you let them see that you're sad about it too, and that it is a tragedy, they're going to feel more open about talking to you. I actually ended up becoming a therapist because I lost my younger brother to suicide when I was a young woman. He was 2 years younger than me, and we had absolutely no indication. He had had some signs of depression, but he was kind of the jokester of the 6 children in our family. On the day that he took his life, he made phone calls, and he was chipper and he was laughing. We found out later on that he had called all 5 of his siblings to say goodbye. So sometimes there's going to be signs and sometimes there's not. So talk, 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 keep the dialogue going, keep it open. And if it's not a good time at a particular time, come back, find out and say, hey, is there a better time that I can talk to you? Would you like to talk to me about this at another time? Or, you know, I've even had family sessions where I've had a child say right in the session room, you know what, Dr. Linda, I don't think I can talk to my mom about this. And mom was fine. And she said, would you rather talk to your grandma? And he said, yes, I'd like to talk to my grandma. So we bring grandma in and they spill their heart out. So the signs of suicide are not going to be the same for everyone, but we have to talk about it. We have to bring it out into the open, and we cannot ignore it, especially now with what's happening now.
Thank you, Trustee, and thank you for sharing that. And I just want to add one thing, and I think I agree with everything you said. The one piece that I want to add is, and kind of like what we're doing today, and we're having this platform where we're talking about mental health and suicide, and it's important to continue to have these conversations, because I truly believe that it starts with awareness, that we can't effectively have intervention and prevention without awareness. I think it starts here. The conversation we're having right now is so important. And so I think we need to continue to have conversations like these, regardless of the setting, whether it be a formal setting, a formal setting, or more of an informal setting. But we need to have these conversations. So thank you.
You're welcome.
Yes, thank you so much, Trustee Cavazos, for sharing that, because it's so tough. According to the American Association of Suicidology, that for every suicide lost, about 147 people are affected by it in our communities. So it's not just that individual, it's not just the family, but it's all the surrounding people, whether it's in the schools, whether it's the teachers, the families that the family members know. And it's so important to have that space to share emotions, because as we're sharing emotions, that's our way of kind of unloading things that we feel, so that we're not just building up this whole thing of, not feeling well and bottling up. And so really
You're absolutely right, Trin. And I have to tell you, one of the things that, and I was a teacher at that time, and, my students were so empathic, when I came back, because I did take a leave of absence. But one of the things, if you want to look, I don't want to say that it is a good thing that happened, but kind of a silver lining. It's what inspired me to go from being a teacher to becoming a therapist. But one of the things was that when I came back and I went into all my classes, and I think I had, I don't know, those of you who've been teachers, I think I had 5 different preps at that time. So one minute I was talking to an English class, the next minute I was talking to somebody in the PE department, okay? They had me all over the place. But one thing that I found out is that because I shared that story, and because I was able to share my emotions, I all of a sudden had these kids. I mean, I have to say, afterwards, I was horrified that I had not seen these signs with these kids that I saw every day. I had so many kids coming up and saying, I'm having thoughts about killing myself. I'm having thoughts, I feel like I could have saved my friend. I didn't see the signs before they took their life. And that's a huge thing. And I think Dr. Jacobs will agree with me, and all of you, that there's always that big why about suicide, whether it's an adult or a child or an adolescent. And I've tried to, when we do these suicide prevention seminars, it's not so much the why, but it's the how did they get to that point? Where did the coping strategies fail? What happened there? Because it's a very multifaceted, issue. It's not just one thing of, we're going to do this or we're going to do that. So the number of students, and we actually started some peer counseling at basic high school after that happened, not just because of me. There were a lot of people that were involved, but I don't know. This is this is something where I feel that Emily right now, Emily's out in the trenches because she's a senior and she's out there and she's doing something good for her peers. So I just want to say that it's funny how life turns out where you have such, just a tragic life altering thing that happens in your life. And here I am, it's very different.
Could I add to that? I wanted to say thank you, Trustee, for sharing. And yes, I definitely, like you said, I'm definitely out in the trenches. I have gone to school with people who unfortunately have taken their lives, and the response throughout the whole school, wherever school I'm at, it is, like you said, it's kind of horrifying. It breaks my heart. I could cry. I don't want anyone else to have to deal with that or see that happen to someone. And so I think it's definitely important to, talk about the how, not the why, because the why, we need to focus on the how so it doesn't happen to someone again. Because as someone who is so young, you don't want to see that happen. And you don't want to see that happen to a number of people, because you're a kid, you're growing and you're learning. And that's why I agree that it's really important to talk about these things now so we can understand. And like, let's say we go back to school, we can have a better understanding of our children and how they cope mentally and how they see the signs differently, and everybody's different. So yeah, it's definitely such a hard thing to talk about. And I want to say thank you to all of you for having and being a part of this discussion, because as a kid, like I said, it's really difficult to see happen to people my age. And I hope that we can all, after this conversation, see that it like Trent said, that it never goes away, but it is always something that we have to talk about.
Yes, thank you so much for sharing, because when
Thank
that
you.
impacts us, a lot of us are hurting. And rather than isolate even more and perpetuate this, why not reach out to each other and say, hey, I'm here for you? And how can we, look at ways to possibly prevent other ones? Or I know we have a question here is, are there trainings available? And so I wanted to post some information here that there are trainings. We can check out the Nevada Suicide Prevention Coalition. There's mental health first aid out there. So if you look for mental health first aid in our communities, they do go over some of that information. But then, we want to talk about also how can we foster as parents or, adults and teachers and all that, how can we foster resilience in our children to kind of combat some of these things that are happening? And this question is for Jennifer.
Yes, thank you. A lot of things we've talked about already, but I think one of the most important things that is to help avoid isolation. I think isolation is extremely detrimental, and we've talked about that. So making sure that you're connecting with friends or family. Some of the things that I recommend are having Facebook watch parties, FaceTiming and texting friends on a regular basis daily, having Zoom parties, even doing activities with your friends where you're physically distant, like Dr. Jacobs said, not socially distant, but physically distant. If your teen has an adult, a pastor, a family member, a counselor who they feel connected with or they feel comfortable in confiding in, have them reach out to them. But isolation is extremely detrimental. Help your teen or help kids find ways for outlets to manage their stress. What are their interests? How can they manage their stress? Can they do relaxation techniques? Can they paint, draw, write? Often when we're creative way to solve problems, or they're having problems or feelings that they don't know how to deal with, often I'll tell them, okay, write a story or short story about it or play about it and come up with the ending that you wanted to see, and let's talk about it. So finding ways that they can engage in activities, what are their strengths? It's important to build on the things that make us feel successful. If we feel successful, if we feel good about ourselves, it helps stave off the depression or the negative thoughts. Self-care is important. We've talked a lot tonight about social media, and I said earlier, it's a two-way sword, you know, it cuts both ways. But taking a break from social media is important too. Sometimes when we are having, in times like these, where it's overwhelming or there's a lot of stress, being on social media, watching the news, video games, those kinds of things can overwhelm us as well. So making sure that we take those breaks from social media when it's too much. And parents, I think this is important. Teaching your child or learning for yourself, it's okay to make mistakes. I think we've talked a little bit about that tonight. Making mistakes is an opportunity to learn, and it's a learning experience. It's also a good opportunity to try it differently or try it again. And in this time, you know, like times like these, it's difficult to stay positive, but our thoughts and our beliefs is how we interact with the world and how we experience life. So trying to have, you know, remain positive and look for things that we're grateful for and have thoughts and beliefs that help us thrive and grow.
Thank you so much for sharing that, Jennifer. I know for me, definitely journaling every day helps because I need to wake up, meditate, run, get my workout in, journal. So finding those ways, and I even have this little thing that I printed out and laminated, and I put it next to my computer that says, what are you grateful for? To really help me remember that there are things, despite everything that's going on, it's really tough. But finding those ways to kind of cope and promote that social emotional health for myself is really important. So we'll wrap up with just one more question for Belinda. How can we increase mindfulness in teens using social media?
Thank you. So one way we can, again, is to become involved, right, in the content that they're looking at and helping them to just be more aware of how social media is affecting them and affecting their feelings, affecting their emotions, right? It's almost kind of asking the question of like, what are you feeding yourself daily? And so kind of looking at what they're feeling, how they're using posting as a way to express themselves. And this is kind of sitting with them and exploring that with them, right? Of like, how does, you know, your friends post, how does this post affect you? And sitting with them and talking about their feelings and what is your intention about going on social media, right? And kind of having them sit with that feeling of like, what's your intention about opening up social media? What do you want to get out of it? Looking at how it affects their relationships with their parents, boyfriends, girlfriends, right? Is social media kind of a source of conflict in the home? Is it something that unites you guys, divides you? Are you, you know, having the most conflict of social media with friends? And so just for them to understand just how their relationships are being affected with social media. And even asking questions like, why are you using maybe Instagram as opposed to Snapchat? And just so they gain more awareness of why am I doing this? Why am I even engaging in these social media platforms? And just helping to guide them, because once they understand kind of that feelings are a part of their everyday life and everything that they're looking at and engaging in is affecting them, then that allows them to really set healthier boundaries, right? And build resiliency and looking at things that they can't control sometimes. And how does that feel? And so setting healthy boundaries is going to be a part of also the social media, right? And one thing that you can help teens with is looking at, okay, what things bring you positive feelings? And can we follow pages or look at stories that have more positive content, and decluttering or removing things that have upsetting or trigger upsetting feelings, right? And so just guiding them through that and showing them how social media can just be affecting your everyday emotions can help them to make better choices when it comes to social media.
Thank you so much, Belinda. And so since we're coming to the end of our program, I'd like to just give everyone 2 minutes, each panelist about a couple minutes to say a closing remark. And we'll go ahead and start with Dr. Sheldon Jacobs. I'll just kind of go in the same order that I introduced everyone.
Actually, no, I want to be a gentleman. I'm gonna let all the ladies go first, and I'll go. Let's
All
do
right.
that. Thank you,
No
Tran.
problem at all. We'll do. So we'll go ahead and move on to Emily. Is there any last things that you'd like to say as closing remarks?
Yeah, I would also like to tackle a question that I was asked in the Q&A section. It said that if I had any suggestions on what any suggestions on students who have lost a peer during this virtual setting, I would just say it's, for me personally, it really is just engaging and socializing with my friends, whether that I primarily call them because it's that really like person-to-person connection. I can't really deal with like words on a screen from someone else. It doesn't feel real to me. And I just want to say that it's hard. What they're going through is hard, and it's something that just be there for the best, like be there for them the best that you can, because especially during this distance learning setting, it is really difficult for kids, and anything helps at this point. Like any little bit, it could be, how are you doing today? Like how did meeting with school go the other day? Anything helps during this time. Thank you, by the way.
Yes, thank you, Emily. So next with Belinda.
So I think a big thing today has been listen. And so I think it really is just listening to our teens in many different ways, right? And how they are communicating with us. How are they not communicating with us? How are they engaging into their phones? How are they not engaging in their phones? How, and just kind of overall just listening to them and noticing and being mindful of just any changes that is going on with them. So that's really it. It's just the whole listening and being mindful of it, and also just being vulnerable with our teens. And because something is sad doesn't mean that we can't talk about it, right? And I think that's a really important just maybe value to instill, is if something is bringing up sad feelings or is distressing, doesn't mean that you can't talk about it.
Right.
Thank you, Belinda. And Jennifer?
One thing I would just like to end with is what we are all going through is hard. It's extremely hard. And there are ways that we can manage it and help it be okay. But there are people out there in our community that are willing to be there for our children, and our teens. But recognizing that, and Emily said it perfectly, it's hard.
Definitely is. And Trustee Cavazos?
Thank you. And I just want to say thank you to all the panelists here. I might have been a little bit more vulnerable today. I should probably not get up so early on the days that we're going to do something like this, but I really felt safe and comfortable sharing that story with you. I really did. So I want to thank you with that. I would say building on our strengths of our children, as far as the resilience, tell them that, just as Jennifer said, and just as all of you have said today, we need to build on the strengths. Maybe if you can even find a reason to have your child smile at least one time a day, especially if they seem to be having a hard time on distance learning or just having a hard time in general, reminding them of something that makes them laugh. Do something that builds on that strength and that resilience. You can even just remind them of something they did in the past. I used to remind mine of something they did when they were little, that even if they were mad at me, it couldn't help but make them laugh, and it just gave them a little bright spot. And again, no matter what, always, always remind your children that you are there for them. You are there for them, and you're willing to talk. And if they don't want you to talk, you're willing to listen and to make that connection. Thanks so much.
Thank you, Trustee Cavazos. And last but not least, Dr. Sheldon Jacobs.
Yes, and I'd like to first, thank all the panelists. I'm going to thank also the public for tuning in to this very important discussion. I also want to thank all the providers out there. I know there's some providers, mental health providers, especially teachers as well, that have tuned in. And I want to just thank you and commend you on just all the work that all of you are doing. You all are doing an excellent job. And I'll say, I think everybody made very good points here. And so one of the things I would say, and I kind of like to sort of compare, mental health to like our physical health. And I want to just use that analogy really quickly. And so the analogy is, and I think all of us have, at one point in time, fallen off a bicycle, right? Whether it be when we were a child, when we were older, like myself, not too long ago. But I think we all have. We've all fallen off a bicycle sometime or another. So the one thing about that, though, is, when we've fallen off that bicycle and let's say we've gotten a scratch or we, hurt ourselves, one of the first things that, we always do is we sort of treat that wound, right? We treat that wound or that cut or, whatever it might be. But the first thing we do is we treat it. And if it's severe enough, we'll go to a doctor, right? Or the hospital. Okay. And so, so even though, those are more physical and visual sort of wounds that we can see, a lot of times our mental health wounds, our mental health scars, we can't see them, right? And so I think that, we have to treat our mental health the same way, because, falling off that bicycle mentally, it could look a lot different. It could be, being rejected in school. It could be, the loss of a parent or the loss of a peer, right? Something as significant as that. And those too are scars. Just like, falling off a bike and cutting yourself, and that turned into a scar, right? So these are emotional scars we're talking about here. And so we don't treat those emotional scars. A lot of times they can become more pervasive, and it can worsen over time, right? So I think we have to treat our mental health, the same way that we treat our physical health. And when we get to that place when we're able to do that, I think we'll be in a much better place as it comes to dealing with our mental health. So again, thank you everybody for making this a great and such an important event.
Yes, thank you for everyone and joining us today, for our panelists, for taking the time out to provide some of your insights and just be able to open up and talk about this topic that's so hard to talk about. Although it's uncomfortable, we know that through discomfort there's growth. And so we appreciate everyone who joined us today, parents, community members, as well as youth alike. I just want to also put out there that we do have a warm line. So if our parents are struggling and you need someone to talk to as well, we do have our Western Nevada warm line, which is 775-241-4212, which I'll go ahead and type that number into the panelist chat so that everyone can have that. We also have our website, www.namisouthernevada.org. If you'd like to see updates on future events, we hold events and presentations such as these town halls and so on to discuss mental health, because it's such an important topic that needs to be discussed, that needs to be normalized, as Dr. Jacob has mentioned. So please visit our website. You can join our email list. We do send out a monthly newsletter of all the events, not only the events that are happening within our organization, as far as the support group that we offer, which is virtual and online now, meeting weekly, but also community events of other organizations that are touching on mental health or suicide prevention or even substance use prevention. So please follow us or also join our newsletter. And last but not least, we also have a resource list that we'd like to screen share for everyone. So with this resource list, we'll be sending out a link that everyone can access if you need to download this. And there's just some remarks about that I'll pull up right here. Here we are. So with the resource list, you can go ahead and go to our website to download the file. We do also want to note that there are frequently asked questions regarding some of these services. So just visit, if you look at the second page with that download, it kind of answers some of those questions. For example, the Early Childhood Mental Health Services offers a day treatment. However, it is currently on hold due to COVID. And let me go ahead and type this number for our warm line in here so I don't forget. And there is also a mobile crisis team. I know earlier someone had shared a resource for that. So I'd like to put that website and link in the chat as well, for others to be able to access. So we have our number for the Western Nevada Warm Line. We have a link for the mobile crisis team. And please, as we said, just take the time to listen. Listen to each other, listen to your children, and we're here for you as a community. We have organizations out there providing support. We want to be here for the community to be able to open that dialogue. So thank you again for everyone who's joined us today. Please have a great night. We look forward to seeing you again at our future events. I'm sorry, one last thing. We do have a Rising Hope, for anyone who's still on, a Rising Hope. Actually, I think it might be part of the resource list. A Rising Hope Festival for Youth that's coming up on November 2nd. Yes, so please make sure you check out their website. And it's basically a festival for youth to come together to discuss mental health from youth to youth. So please share that with your children, your teens. Parents and families are welcome to join as well. There will be an event from 10 a.m. to 2 p.m. So please check out their website and register for the event on that day. It is free and open to all participants.
Yeah, so can I add real quick, Trent? So for that event, there's going to be a lot of local celebrities, several Raiders players, several entertainers will also be taking part in that event. So it's going to be a tremendous event. So definitely make sure you register for that.